Hello and welcome. My name is Molly Shen, and I'm an anchor with Como 4 News, and it's a great pleasure to be back here with you today. We're all here to support Navos and the Growing Hope Luncheon in support of programs for vulnerable children, youth, and families in our community. So thanks for joining me for this event today and for your support of Navos and their partners, the Ruth Dykman Children's Center and Seattle Children's Home. I'm going to see if I can I switch to these? See, this was my super mic for everybody still walking in. Well, as I said, we're here to support Navos and their partners, the Ruth Dykman Children's Center and Seattle Children's Home. Together, each with a legacy and a reputation for responding to the health needs of vulnerable children and youth, they are united to become a stronger and even more effective super provider. 1 in 5 children has a diagnosable mental health issue, and 1 in 4 adults. Anyone, absolutely anyone, can have a mental illness, regardless of age, gender, race, socioeconomic level. Mental illnesses are more common than cancer, diabetes, heart disease, and AIDS. In fact, can we see a show of hands in the room for anyone who knows someone who at some point has dealt with a mental illness in their lives? I know I'll raise my hand with my niece on my mind. This can be a friend, a family member, a colleague. Go ahead and keep your hands up for a moment if you can, because I want everybody to just look around and see the room, see how many people have their hands raised right now. All of us understand the impact that mental health has had on people in this room and in our community. So thanks all of you for sharing that. If you or someone you know had a child who'd been diagnosed with cancer, you know that there would be an incredible outpouring of support and sympathy for you. Offers of help from family, from friends, from colleagues, other parents at school. Unfortunately, though, because of stigma, it's not the case when there's a mental health diagnosis. Instead, there is isolation and shame, embarrassment, and loneliness. But we're all here today, this very large and diverse group, because we feel compassion for the people in our community with mental health issues. And we all share this desire to understand, to help, to support, to get rid of that stigma. I want to take a moment now to thank all of the table captains who are here today, and I'll ask all the table captains to stand. These people have all rounded up their friends, their colleagues to join them here today so that they could share the passion of the programs. Thanks to you, the table captains, for your support of Navos, Seattle Children's Home, and Ruth Dykman Children's Center, for all your help to make Navos' signature fundraising event a success today. And I want to thank you, or have you thank with me as well. Join me in thanking the current members of the Navos Volunteer Board of Directors, as well as past members of the Board of Directors from Seattle Children's Home and Ruth Dykman Children's Center that are here today. These people volunteer many hours of their time and their expertise because they care so much. Their commitment to the mission is laudable. So let's have board members and former board members as well also stand to be recognized, please. Thank you for all your support. Join me as well in thanking all of our sponsors of the event today. Because of their generous support, every single donation that is made today goes directly to support programs and services. It doesn't go to cover the lunch, the dessert, anything like that, the room. It all goes to support the services. We have quite a few sponsors, we're fortunate to say, so I'll have you hold your applause until the end, please. We have 4 platinum sponsors today. Abbott Construction, this generous company who has built several projects for Navos. Brooks Power Group. Tom Powers, the co-director for Brooks Power Group, served on the Seattle Children's Home Board of Directors and now serves on the Navos Board of Directors. Seattle Children's, a longtime supporter of both Navos and Seattle Children's Home events. And the Carrie Oliver Guild, a generous group of women who have supported the programs at Seattle Children's Home for over 30 years. Thank you all for your generous support. Let's have some applause for our platinum sponsors. Our sponsors today at the gold level are Amera Group, AT&T, BN Builders, G.A. Davidson, Genoa, Carr Tuttle Campbell, Kibble and Prentice, Methune, Sisters of Providence, Sterling Realty Organization, and U.S. Bank. And our silver level sponsors are AAA, Amerinet HRS, Bradson Consulting, the Brickman Group, Cascade Behavioral Health, Coordinated Care, Easy Street, Heartland LLC, Molina Healthcare, Moss Adams, Objects, Perkins Coie LLP, Physicians Insurance, Sigmund Software, Sunbridge Finance and Accounting, Cisco Seattle, Technon, and the Washington State Hospital Association. Thank you all. That's a great list of sponsors. The role these sponsors play to help support Navos' programs and services for vulnerable, at-risk children and youth is something that we can't thank you for enough, the generosity and the caring about our community. I wanted to have you welcome our public officials who have joined us as well today. I'll ask that each of these officials stand as I read your name, but again, we'll hold our applause until I've announced everyone, please. Representative Ruth Kagi of the 32nd District, King County Council Member Joe McDermott, King County Council Member Dave Upthegrove. Representing United States Representative Jim McDermott today, we have David Loud with us. Outreach Director Richard Lazaro for U.S. Senator Patty Murray. State Outreach Director Tommy Bauer for U.S. Senator Maria Cantwell. District Scheduler Bree Rayborn for Congresswoman Susan DelBene, and the Deputy Mayor of Burien, Nancy Tosta. Also, I just wanted to mention that we had a couple other guests who were attending, but you might know the special session began in Olympia today, and because of that, Washington State Senator Jeannie Cole Wells from the 36th District and Representative Tina Orwell of the 33rd District had planned on being here, but were not able to join us. Thanks to all of our elected officials in attendance for supporting the programs and for joining us today, and for everything you do to represent our community. I have just one more thank you. Maybe this is the most important one as well. Thanks to all of the Navos staff and volunteers for all of the hard work that goes into hosting this incredible event. This event wouldn't be possible without all of your efforts. It takes a lot of work behind the scenes to get this done. Thank you. All right, there is a special treat on the table for everyone. You'll see it right there at the centerpiece, the little candies. I want to make sure that you see those and take them with you today. And I just wanted to draw attention, too, to the fact that there's featured artwork on each of them. Those are done by some of our Navos youth, so those are beautiful. Make sure that you don't forget that. Also, when you came in, you saw a book, Personal Safety Nets, at your seat. A very special gift for you from our honoree today, Judy Piggott. So there's such wonderful information in that book. Make sure that you don't leave that behind as well. Table captains, also, I know you have a yellow envelope that you received when you arrived. I'll just ask you to hang on to that right now. You don't need to do anything yet. A little bit later in the program, I'll give you some instructions on what you need to do with your envelope. Right now, though, it is my pleasure to introduce Dr. David Johnson, the Chief Executive Officer of Navos. David has been a leader in our community. We can go ahead and clap for him. David has been a leader in community mental health for over 35 years and the CEO of Navos for the past 15 years. Under David's leadership, Navos has become one of the largest, most innovative, and most respected community mental health providers in the state. In 2014, David was recognized by Seattle University as the recipient of the 2014 Alumni Award for Professional Achievements. In 2013, David was recognized by the Council for Community Behavioral Healthcare with a Visionary Leader Award, and was also the recipient of the 2013 Evergreen Award, which honors outstanding nonprofit leaders for their innovation and agility. Please welcome David.
You have your own? Yes, thank you. Welcome. Thank you so much all for taking time to be here. I want to start out by recognizing somebody who's retiring today from Public Health of Seattle and King County. Somewhere out there is Dr. Colin Romero. We're waving at you wherever you are. Yes, back there. Colin is a visionary leader himself, and he did a lot to help the birth of our integrated care clinic at our Mental Health and Wellness Center down in Burien. And not only did he help put together the administration for that, Colin actually worked there as a doctor, helping us hone that model. So congratulations, Colin, on retiring. Yay. You know, anyone traveling the streets of Seattle is familiar with the tragedy of homeless individuals who are not able to even care for themselves. People with untreated, serious mental illnesses comprise over a third of the homeless population. And many of them, almost 30% of them, their source of food is from the garbage cans. And they are accosted and harassed and abused frequently. Despite meager resources, we at Navos provide housing, inpatient and outpatient services, primary care, employment support, and other specialized programs for people with serious and persistent mental illnesses at risk of homelessness. Our services make a huge difference, and our clients can and do recover. Navos also invests in the future in providing services for children challenged by serious emotional and mental illnesses. Many children have mental illnesses that go undetected and untreated for a long period of time. I just came from the National Council where they're citing the average length of stay as 7 years between when symptoms first appear and kids finally get the services that they need. We can best stop mental illness from progressing if we can intervene early. And those mental illnesses are often caused by or exacerbated by traumatic experiences. As Molly was saying, each year, 20% of children in this country have a diagnosable mental health condition that could benefit from treatment. And a third of adolescents between 12 and 17 years old in the United States have had at least 2 traumatic childhood experiences. And those are experiences like sexual assault, physical abuse, domestic abuse in the home, community violence and school violence, and suicide by people they care about. So over the past 5 years, Navos and Ruth Dykman Children's Center and Seattle Children's Home have merged together to create a continuum of services for children and youth in need. Together, we've created a behavioral health center on the shores of Lake Burien, and we offer a sanctuary for services dedicated to help heal from trauma and to help heal from mental and emotional illnesses. The demand for services, as you can imagine, just keeps growing, particularly in the south end of King County, where refugees and immigrants and families living in poverty have migrated because of the skyrocketing housing costs in Seattle. We know that intervening early can stop the harmful progression of mental illness and lessen disability and can sharply improve outcomes. Because children develop rapidly, if we let it go too long that they're having abnormal thoughts and behaviors, the cumulative effects can make recovery much, much more difficult. Without help early on, these children grow up to have higher healthcare costs than other adults. If we don't treat them early, childhood disorders may lead to a downward spiral of school failure, underemployment, and poverty in adulthood. Many children and adolescents have the double whammy, the double problem of a mental and emotional illness and a substance use disorder. And if one of those co-occurring disorders isn't addressed, both conditions deteriorate. These kids are at especially high risk for a myriad of expensive and tragic challenges later on, with unusual medical problems, unemployment, homelessness, incarceration, and suicide. Left untreated, these children can become the homeless, mentally ill adults of the future. And so that's why we at Navos provide comprehensive inpatient and outpatient services for children, even babies and toddlers and their families, and for youth. We've been a leader in pioneering infant mental health and early childhood mental health so that we can ensure that babies who are at risk of abuse and neglect, that their families, their caregivers, their parents, their foster parents get the treatment and help they need so that we can break that multi-generational cycle of abuse. We also go to where the kids are. We're working in over 50 schools. We have expert staff who are consulting in daycare centers throughout the area. We offer a residential treatment program for kids from 6 to 12 who have been removed from their homes or removed from their foster placements because of traumas they've experienced there. And on the shores of Lake Burien, we provide intensive wraparound services for these children who have multiple and acute needs. Navos also provides an inpatient program for adolescents between the ages of 13 and 18. Who are having emerging major mental illnesses like schizophrenia, bipolar disorder, and severe depression. These young people often come to us in an acute suicidal crisis. And they often come to us because they've exhausted all other treatment options. So we provide individualized treatment with evidence-based best practices to try and help these people develop better coping mechanisms, to take better care of themselves, and to get them back into the community as quickly as possible. And a little later, you're going to be hearing from one of the graduates of that program. We recently opened Independence Bridge. This is a 24-unit apartment building for people 18 to 24, people coming out of the foster care system who have mental health issues. In the past, those people on their 18th birthday would be thrown out on the streets and told they're all grown up, and they are not. They're especially vulnerable. And so we're so proud to be able to offer a supportive community that will help them launch a successful adulthood. These people are particularly vulnerable to homelessness, to drug and alcohol abuse, to sexual trafficking and being victimized by that, and also having babies too soon, babies that often end up in the foster care system themselves. And again, we're aiming to break that cycle. With compassionate and comprehensive treatment, children and youth can and do get better. Early childhood intervention, such as those that we provide at Navos, have been found to have a return for the community, a return of $17.07 for every dollar that is spent on treatment early on. State-funded mental health programs like ours have suffered deep cuts in some years, and then in other years, just stagnant rates. And so there's developed a great disparity between what it really costs to do the effective treatment we provide and the public funding for that. Not a coincidence that that issue is what brings us before you here today, trying to make an urgent case. If we're to sustain these programs, and we want to sustain these programs, but if we're going to do that, we need help from the community. So thank you for being here today, and thank you for whatever investment you're going to be able to make in the future of these children and youth. Your gifts to these most vulnerable people are an investment for a healthier community for all of us. So I'm now looking at Judy Pickett, giving her a subtle sign that she's going to be coming on stage soon. A few years ago, Navos set about to honor one individual each year for their extraordinary efforts to pioneer new approaches for the understanding and treatment of psychiatric symptoms, to literally expand the horizons of theory and practice and confront stigma. Past recipients include the amazing Dr. Jennifer Stuper, whose pioneering work in combating stigma and even more astonishingly, combating suicide and decreasing suicide is amazing to us all. We next gave an award to Margaret Larson for her work battling stigma. Dr. Trez Buckland was the next winner for her astonishing work in making connections between young adults who are managing psychiatric symptoms and her work in promoting appreciative circles. And then last year we gave the award to Dr. Delaney Rustin. And we're so glad that Trez and Jen are here today. Thank you for being here. Today we get to honor our friend Judy Pickett. with the 2015 Expanding Horizons Award in recognition for her exceptional innovation that leads to a healthier community. Judy's pioneering endeavors have developed the empowering personal safety net model, and she's very graciously given you the book here that you'll be able to see later. Her work in advocacy of the arts and health and human services demonstrate an impressive way of making the entire community more healthy. Judy is noted in the Northwest for her experiences in teaching, facilitating and mediating, parenting, volunteering, and advocating for communities. She has a degree in psychology from Skidmore, and she has a master's in teaching from Teachers College at Columbia University. And she has training and experience in hospice work and creating share care teams. She's committed to fostering communities that nurture all participants' physical health, intellectual health, emotional health, and spiritual health. She knows about wellness. As the founder of Personal Safety Nets, Judy, a Washington native, created a model for more caring, connected, community-minded circles for families, friends, and our workplaces. Judy has visited all 7 continents, and she's got some great pictures of Antarctica most recently. And she's found that deep down, all people want the same things: peace, safety, community, and sufficient resources for themselves and for those they call family. She has served on the boards of Seattle Biomed, Camp Brotherhood, Seattle Prep, and Arts West Gallery and Theater. Each one, she says, has offered a different window into the world. Judy has 4 grown children and 10 grandchildren. That's amazing. All of whom she believes will be better off if they learn to support one another and see the benefits of collaboration rather than conflict. Judy has been a great help to Navos. She's a valued supporter of Navos programs, and we are grateful for her generous and enthusiastic advocacy and her efforts as a connector. Come on up, Judy. Thank you. You get a prize. Judy gets a prize, and she gets to hold it for about 1 minute, and then she has to talk. There we go. Okay.
Okay, that's a minute.
That's your minute.
I get to take it off.
Thank you, David. And thank you for the board of directors. And I understand there's some group that made this decision. So thank you very much. But really, I think the award belongs to everyone in this room. Each of you is here because your life has been touched by mental health issues. Each one of you has come and you've made a donation of your time already. You've made a donation of your spirit, and you may be able to make a donation of your dollars too, and that would be wonderful. Navos walks its talk. It weaves a safety net that is for and with the people who come into its circle. I think that is so important. Navos sees assets where others see liabilities and disabilities. Navos works sometimes first with the people who care about someone who comes, but it moves forward and works with the people whose lives it's touching. Whether it's because of a persistent, systemic kind of a psychiatric illness that will never fully be resolved, or whether it is a mental health issue that arises because of some kind of a situational development, which might be a substance abuse issue, it might be homelessness, it might be domestic violence, it might be any of the things, hi Joe, any of the things that arise in the lives of most of us at some point or other. Regardless of what it is, Navos works with those people. One example is the peer counseling program, and I've been privileged to work with peer counselors. Another will be the cafe, and the catering that's rising out of that is an expression of where there is strength. We all matter in this world, and we all need to matter to someone else. We all have something important to say, and we need to have somebody listen, and that's why there will be a video in a few minutes. I think that everyone here believes in the importance of having a hope-filled vision of tomorrow, as well as crafting for ourselves and those we care about a personal safety net, a holistic way of looking at our lives that will allow us to be resilient and resourceful. So John Gibson and I wrote a book. It's about teamwork. I hope it helps you. It's helped some others, and I hope you can spread it out. Thank you very much.
She is so lovely and has been in so many ways. Joe McDermott has joined us, and that's why you got the award. Thank you so much. By the way, Judy's birthday is tomorrow. Happy birthday tomorrow, Judy. Our guest speaker today is my colleague, Jim Volendroff. Jim has worked in the behavioral health field for over 30 years, and he doesn't look like it at all. He has a master's in public administration and is nationally and state certified as an addiction counselor. He's managed both inpatient and outpatient programs for adolescents and adults, and he's worked for Providence Health System for 13 years before his transition to King County in 2002. He's worked extensively with the criminal justice system in both design and implementation of correction-based and drug court treatment programs. He has extensive experience in training and implementation of evidence-based programs across systems. Currently, Jim is I'm letting Jim know he's coming to the podium very soon. He is the Division Director for the King County Mental Health Chemical Abuse and Dependency Services Division, and he's responsible for the delivery of mental health and chemical dependency treatment for low income and the Medicaid population. The division has a staff of 150 people. They manage $280 million and to serve approximately 80,000 individuals a year. And Jim, we are giving you a prize too. We're giving you a Mental Health Leadership Award, not only for the wonderful work you've done in the past, but the initiatives you have going now. So congratulations, thank you. Yes, and I predict, it's quite impressive. I predict that after you hear Jim speak today, you will know there are even more reasons that we particularly applaud his leadership.
Great, thank you. Good afternoon. I'm going to start by emptying my pockets here for just a moment. I have a rock from my husband that says, "You can do it," so I got to take that out. And I've got something from my mother who says, "You're a superstar," so I'm going to take those things out to get through this couple minutes here. So I would like to add my own welcome and thank you on behalf of King County for attending today's Growing Hope Luncheon. Thank you for supporting Navos, and thank you for the work that you do every day, David, and your staff, to improve the lives of people with behavioral health conditions here in King County. I am honored to be here today and share my story. It's something that I've only recently become comfortable doing, and I think it's critically important. Speaking openly about how mental health and substance abuse has impacted us on a very personal level is one of the ways that we can reduce stigma associated with this condition. If you had asked me when I was 15 to reverse those numbers and speculate on what I would be doing at age 51, which I am now, I can assure you that the last thing I would have said was anything near how my life has turned out. I know definitely that I would not have said, I'm going to be the director for the King County Mental Health, Chemical Abuse, and Dependency Services Division. I'm pretty sure I probably couldn't have even said that when I was 15 years old. But I am here today to share my story, and as I do that, I ask that you reflect on your own story. Molly already mentioned it, and we heard it from others today. We all have a story to share. Mental health and substance abuse has touched all of our lives in different ways. So whether it's about yourself or a family member or a friend or neighbor or coworker, I ask you to stop for just a moment and think about how sharing your story might help others who don't understand behavioral health. How it might help others who are struggling in isolation around their own substance abuse or mental health conditions. And finally, how it might help reduce the stigma that's associated. So I ask you to think about that as I'm talking and be prepared to take some bold actions related to your thoughts today. When I was 15, I did have people ask me about my future. And I would often stop and think, I really don't see much of a future, and I would say to them, I don't know, and I don't really care, while simultaneously thinking to myself, I probably won't be around. You see, I had a plan, and that plan was to end the pain and confusion and deep shame that I was experiencing as a very confused and isolated 15-year-old adolescent. My parents were children themselves when they began to raise a family. By the time my mom was 24 years old, she had 7 children and was married to an abusive alcoholic husband. My childhood was fairly chaotic, and it was very full of contradiction. We went to a private Catholic school, but we also had a lot of turmoil and chaos going in our lives. Being ushered out of the house in the middle of the night to the safety of a motel room was not uncommon. Coming home to my dad passed out with a gun at his side, and us tiptoeing to our rooms was fairly common as well. My mom put up with the abuse for a lot of years. She put up with it because she had 7 children, and she felt like she needed to stay in this relationship. But as the abuse began to get progressively more violent, and particularly as it transitioned from her to her children, she decided that she needed to take action. When I was in the 7th grade, my mom showed up at work, and I was pretty sure we were going to go to a motel and we would be there for a few days until things returned to normal. But this time was clearly different. My mom packed us up in a car, and we drove to Washington State, where I have lived ever since. You might have thought that that would be a turning point in my life and that things would get significantly better. And that was certainly my mom's intention behind this move. But let me remind you, I was 13 years old at the time. So packing up and moving from California to, of all places, Aberdeen, Washington, was shocking to say the least. Especially, considering I already at that age was fairly certain that something was seriously wrong with me. So things went from being bad to worse, if you can imagine that. Although things were chaotic in California, I did fairly well in school because that's where I was able to be safe and really concentrate. So I quickly went from being an A/B student to dropping out of school. I was severely depressed, and I was holding on to very deep secrets. I was full of shame, and I was desperate to end the fear and isolation that I was experiencing. And worst of all, I believed that nobody cared. I believed that I was all alone and that nobody would understand what I was going through. So ultimately, I decided that I was better off dead than alive. I decided that the depression and isolation was unbearable, and I feared what the future held for me, and I really only saw one way out at age 15. So at age 15, I made my first attempt to take my own life. My first attempt was by overdose, and that did not work, thankfully. We kept a gun in the house. And thankfully, my mom was wise enough to take measures to secure the gun so that on the night that I went into their room looking for it, I didn't have access to that gun. I'm fairly certain that I wouldn't be here today if I had had access to that gun, so I thank my mom for that. Okay, take a deep breath. As a teenager, I was involuntarily hospitalized at a psychiatric hospital on at least 4 occasions. It's kind of hazy after all these years, but during a particularly difficult hospitalization at University of Washington Hospital, as a matter of fact, which I drive by coincidentally every day on my way home, which is awesome, it was determined that I should be hospitalized at Western State Hospital. I don't really understand the details to this day, but somehow my mom intervened, and she convinced the judge that it would be better for me to be released to her care and to get enrolled in outpatient mental health treatment and be prescribed medications than be admitted to Western State Hospital, so that occurred. So while the inpatient hospitalizations were critical to my survival at the time, it was the community-based outpatient treatment where I really feel like I got well. I learned to accept myself and to be honest about who I was. I also developed the coping skills that I continue to use to this very day. There were still some turbulent years ahead, but thanks to the counseling and support that I received, I'm proud to stand before you today. I'm proud to be an example of what good community-based mental health services can provide to young people in need. I'm free from guilt and shame about my past struggles, and I celebrate the fact that my past struggles have made me the person that I am today. I am so grateful to be in a position where my lived experience can influence policy. When I visit agencies like Navos today and I meet individuals in their care, I frequently find myself asking, what good will they do in the world? What change will they make to make our community a better place? With the help of programs like Navos, people's lives are changed and people do in fact recover. So thank you for coming today. Thank you for letting me share a piece of my story. Please join me in thanking Navos for the work that they do every day. The services that they provide help individuals with behavioral health conditions thrive in our community and make our community a better place. So thank you.
Jim, thank you. Wonderfully done. Well, congratulations to Jim and to Judy both, and thank you for the great work that you both do in our community. And Jim, thanks for sharing that story. We could tell by the deep breaths and the levels of encouragement that it's not easy. Why would it ever be? It's so well told and so important to tell. Now we ask that you give your attention to a short video. This has been developed by Navos and Sparkworks Media, and a huge thanks in advance to the Navos staff members and from our residential programs and for the children and youth who have participated in this video. Take a look, please.
Lying, thinking last night how to find my soul a home, where water is not thirsty
and bread loaf is not stone.
I came up with one thing,
and I don't believe I'm wrong.
That nobody,
but nobody,
can make it out here alone.
Alone, all alone, nobody,
but nobody,
can make it out here alone. The youth that come to us are scared, they're feeling unloved, they're feeling undeserving of anything good.
When some of these kids come in, they have experienced some pretty horrific abuses.
Physical abuse, sexual abuse.
Bullying at school. Their families have rejected them, or just society has rejected them.
Dealt with domestic violence, assault.
This is our kids that could easily kill themselves out there.
When kids come in the middle of the night, it's never good. It's usually because something big has happened, and they're coming from an immediately scary, dangerous situation.
That child might come to us at 4 o'clock in the morning with nothing with them other than the pajamas they are wearing.
The day when kids arrive, they come with sometimes garbage bags with all of their belongings, and they're arriving to a place where we're all strangers and they don't know us.
It's heartbreaking to hear about kids who don't know what it's like to feel loved, who grew up in a home where they really weren't part of a family.
One of the youth that I worked with had a lot of history of kind of sexual abuse, and her self-harm stuff was very different than a lot of people's self-harm, where she was kind of eating objects, and she was at a point where we had to physically restrain her.
And I remember standing in a room, a large room, with her, and her just screaming at me and telling me that I had lied to her, and she really was feeling abandoned. It took everything I had to keep it together in that room. And as soon as I was behind another door, I just lost it. Because you feel their pain.
This is crisis work. This can be dangerous work. Again, the youth are coming to us because they've been really unsafe. They've been in scary situations and are reacting from that.
And they are left alone and in a very fragile state at a point where intervention can create a huge difference in their life.
And when they're able to come into a place like Navos and the residential services, and they're told, hey, you're not too hard, and we can keep you safe, and we can handle this.
If we're able to work with these individuals that are experiencing early onset mental health issues, early onset substance use issues, we have the opportunity to create a better society for all.
They're going to counseling, they're gonna go to school, teach them how to be independent, teach them how to be in a community.
The government is slashing programs that assist their mental health population, but because of that reduction is why it's needed even more. This is where Navos is filling that need for the mental health population.
From adult care to infant mental health, they're spanning generations to help people.
Without Navos, the future doesn't look very bright for these kids.
They may not make it to adulthood. They may not have the opportunity to break that cycle.
These kids who are kind of the discarded kids in our society, how do we want them to grow up and perceive themselves as part of their community?
We can't just toss people aside and cut programs. It's not going to help. It's not going to help society.
I hope people will support Navos because the work we do is invaluable.
I want kids to feel deserving of good things.
If I can give the children anything, I would like to give them courage, resiliency, and hope.
I want them to understand that life can be different. Life can be fulfilling.
When you leave here, I hope that you feel like you were cared for, that you feel like you mattered and you were important. And they don't have to remember who I am, but I hope that they remember the feeling that I gave them.
You're not alone. As long as our program is here, you will never be alone.
Really, really beautifully done. Thank you again to the Navos staff members, not only for participating in that video and sharing your stories, but thank you for the work that you do in and out every day. I have a very special guest to introduce to you now. She's here to share her personal story of recovery. Please welcome Amaria.
Hello, my name is Amaria Lewis, and I'm currently 18 years old. I'm going to share with you parts of my story that have led me here today. 2 weeks after my 17th birthday, I was rushed to the ER at Seattle Children's following a suicide attempt. I had been hurting for too long and running out of hope. From January all the way up to that day in March, I kept questioning my reasons to live. A few days before this incident, I was kicked off my dance team and asked to take a break from the studio. There are reasons for this that I will not go into. However, I already felt that I had lost everything because for years, dance has kept me going and been the last thread of hope in my life that I've hung on to. But this was not my first hospitalization or suicide attempt. The first time was a day in February when I was 14 years old and home alone. I tried to overdose. I went to sleep thinking I would not wake up, and I only remember 3 moments after that, the house being dull, quiet, and very dark, and wondering if I was dead. And I remember crying when someone finally came home. The second attempt was another overdose, almost 1 month afterward. This time, it was a week or so before my 15th birthday. I only remember telling a woman online what I had done and her asking me to tell my mom, and then my grandparents' tired and sad faces in the ER. December 2012 must have been the third time. This attempt placed me at Fairfax Hospital. I will not tell you what I remember because I can recall everything, including the smell. I will tell you the important things. At this time, I was coping with fresh memories of my dad abusing me for the first time. I must have been 14 when it happened. My sister and I had got into a big fight that got so messy someone called the police. I remember my dad coming back to the apartment and yelling at me, and I quickly fought back. I called him out on his inconsistent presence in my life, telling him he didn't have the right to speak to me the way he was, and that's when he put his hands around my throat. Before that day, I had been hit before by other people, but those moments were nowhere near as traumatic as this one. One night at Fairfax, a conversation with my doctor brought awareness of something traumatic that happened to me when I was younger. He asked me questions about some of my experiences, and one of my answers included a story that happened when I was in the 2nd grade. I can't go into detail about what happened as this is something I'm still working through today, but I can tell you at the time it was a very hard realization to face. Here I was, 8 years later, learning the truth about things that really happened to me when I was younger. When I left Fairfax, I had hope. It's a surprise to me when I read old journal entries from that time, considering I had 2 fresh traumatic experiences I had to deal with, which is probably why my depression worsened over time and my behaviors repeated. Going back to March of last year, the moment that made me crack was after a fight I had with my grandma. I ended up being placed at Seattle Children's inpatient psychiatric unit and stayed there for a little over a month. I was released to go home on a restrictive order, but I was only home for 4 days because I violated the order. So I went back to Seattle Children's, and from there I was sent to the McGraw Residential Treatment Program at Seattle Children's Home. Coming to McGraw, I didn't believe they could do anything for me. And as months passed, my doubts only grew stronger. When I say I went through hell and back being there, it's not an exaggeration. I had some really hopeless moments at McGraw. There were many times where I felt stuck, alone, and unsupported. Unfortunately, it took me reaching the lowest moment of my life to see that none of these things were true. When I realized the staff around me were genuine and worked for the clients, I think I was able to take my wall down and be fully invested in my own treatment. There are staff there that I personally hurt out of pain and anger, and yet those same people remain by my side. There are staff who saw the worst in me and still cared for me. There are staff who saw me give up on myself countless of times and still believed in me. I can honestly say nobody turned their back on me, even in my darkest moments. I have Navos to thank for who and where I am today. Today, I can stand here and tell you that I am healing. There are people who witnessed me in some of my lower moments before I left for McGraw, and they ask me if I'm doing better now. I never sugarcoat things, but I don't belittle my situation either. I'm honest when I tell them, and you all here today, I'm recovering. Some days I feel like I've taken leaps forward, some days it seems I've gotten nowhere. But when I envision the days leading up to McGraw, I see that I'm a much stronger person. I don't know when, and if ever, I'll be fully or completely okay and recovered. I don't know, I'm sorry. It may be something I am always working through, but I have faith that I can be successful. I am back at my dance studio, and I am attending Shoreline Community College. I'm also taking an English teaching course online. After Shoreline, my plan is to continue my education at the University of Washington. I have many goals for myself. I want to pursue a career in teaching, publish books, and in some way work in the field of social work. Thank you for listening to my story.
Amaria, thank you so much. Again, it is not easy to share your story. Amaria did a wonderful job, don't you think? We all appreciate that type of courage that it takes to stand in front of this group and share such personal things. Now, it's your turn to do something today. Today, you can make a difference for the vulnerable, at-risk children and youth, like Amaria, who are living in our community and who need help and look to Navos for both treatment and support. Table captains, go ahead and hold on to those envelopes. I'll let you know in just a moment here when it's time to distribute those donation cards. Oh, some people are already doing it, aren't you? I heard laughter as soon as I said wait, but that's okay. That's all right. I don't mind if you're going to jump ahead on something. That's a good place to do it. Because government dollars don't cover the expense of treatment, to help them with their recovery, support from the community is needed to fill this gap in funding. David mentioned it, and there are cards on your table that talk about a really large gap that we experience in funding. So you can help sustain these critical programs, because every baby, every child, every teenager has the right to mental health services, even if they are living in poverty, especially if they're living in poverty. 1 of 2 mental illnesses start by the age of 14. 1 in 2 teens experiencing a mental illness drop out of high school. Suicide is the 3rd leading cause of death in youth ages 15 to 24. And 70 to 90% of people receiving treatment for a mental health issue experience a significant reduction in their symptoms. As was said with so much feeling in that video that we watched a moment ago, children and youth are never alone with Navos to help them. Navos helps them recover from their past trauma and their neglect. This is our time to help break that cycle of that poverty, the abuse, neglect, and violence that can be inflicted on children and youth. Left untreated, these children and youth can be the homeless adults of tomorrow. I have a special announcement about a challenge that we have for you today. A group of our legacy donors have pulled together to create a match pool of donations, especially for this event, and it totals $45,000. These are very generous supporters of our work to change public policies and to better provide mental health and wellness to those who are in need. For every gift that is made today of $500 or more, your gift will be doubled by this match pool. So for those of you who already started filling out your cards, that is okay, but maybe go back if you want to change your donation amount to $500 and be matched today. When you break it down, it's $41 a month, and I know a lot of people spend more than that every month just on getting their morning cup of coffee. I'd like to read off the names of these generous donors. We'll keep our applause until the end, but I want you to know who's supporting this matching pool today. Alice Braverman and Patrick Kafer, Dana Bojess, Bobby and John Bridge, Lisa and Phil Hay, Charles and Marie Hoffman, Carrie Holmes, Robert Holmes, Mary and Norm Ives, David Johnson, Megan Kelly, Matt and Nancy Mylon, Patty and Jean Newberger, Nat and Pooh Penrose, Judy Piggott, Catherine Switz and Mark Sussman, and Mellet Winston. Let's give a big round of applause to this great group of supporters. Okay, so I am asking all of you to stretch your dollars today and consider making that gift of $500 or more. You can do that as a pledge, a one-time gift if you want, or you can also do it as a pledge of $41.66 that would come out per month for the next 12 months. And remember that we do need your support to sustain our programs and help these at-risk children and youth. So that's the challenge. A gift of $500 or more will be doubled today by our match pool. Of course, a donation made in any amount that you can spare today is greatly appreciated. So table captains, go ahead and hold up your envelopes if you haven't started distributing them already. I think a lot of people have. So I'll skip the hold up your envelopes part. Go ahead and get them turned around. Pass out your individual envelopes to all of the guests at your table. As you make your gift today, just please bear in mind that match that we have before you. Think of Amaria and the stories that you heard on the video today from our dedicated staff members as you make this personally significant gift to Navos. This is our chance here today to fill that gap in funding that is needed to sustain these critical programs for children and youth. Join Navos in our vision. You are part of the solution today. Because government dollars don't cover the expense. Because every child and every teen has the right to mental health services. Thank you so much for your generosity and for investing in Navos and the children and youth that we serve. When you have completed your pledge cards, you can go ahead and just pass your envelope back to your table captains, please. And then table captains, we have volunteers who will come around and collect those from you in the envelope packet altogether. And in fact, it would be helpful once you have it if you just raise up your hand with your packet as soon as you're done. As we wrap up this wonderful event today, I just want to say another thank you to everyone who has come here today and made this commitment to be here. I hope as you leave, you feel wonderful about the good that you've done today in supporting such critical community programs as you go about your day. I'm sure some of these stories you'll be reflecting on them in your mind. Thanks for the generous support of Navos with partners Seattle Children's Home and Ruth Dykman Children's Center. And mark your calendars for the Navos 2016 luncheon event. It'll be held right here in this room. We'll be back here on Thursday, May 5th of 2016. And if you're on Facebook, just a final little social plug, please become a friend of Navos and like the Facebook page. Thanks again for your support today. Have a wonderful day.